Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Pregnancy. Third trimester. What to expect. Introduction. The third trimester of pregnancy refers to weeks 29 through 40. Pregnancy lasts about 40 weeks, counting from the first day of your last normal period. Some of the same discomforts you had in your second trimester will continue. Many women also find breathing difficult. You may have to go to the bathroom more often, but these problems will lessen once you give birth. This program explains the third trimester of pregnancy. The program includes information about your baby's development, your physical and emotional changes during this time, and lifestyle changes during pregnancy. Third trimester. Your baby. Many important changes are taking place during the third trimester of your pregnancy. Your baby will continue to grow and develop until he or she is ready to be born. At 32 weeks, your baby will have bones that are soft but fully formed, eyes that can open, close, and sense changes in light, lungs that are not fully formed but able to practice breathing movements. Your baby's body will begin to store vital minerals such as iron and calcium. By week 32, your baby will be gaining weight quickly. He or she will gain about 1/2 pound a week. Your baby will be about 11 inches long and weigh about 4 pounds. At 36 weeks, the protective waxy coating that covers your baby's skin will get thicker. Your baby's body fat will increase. By week 36 of pregnancy, your baby will be getting bigger and bigger. He or she will have less space to move around. Your baby's movements will be less forceful, but you will feel stretches and wiggles. Your baby will weigh about 6 to 6.5 pounds. By the end of 37 weeks, your baby will be considered full term. Your baby's organs will be ready to function on their own. As you near your due date, your baby may turn into a head-down position for birth. At birth, your baby may weigh somewhere between 6 pounds 2 ounces and 9 pounds 2 ounces. He or she will probably be 19 to 21 inches long. Most full-term babies fall within these ranges, but healthy babies come in many different sizes. Third trimester, your body. Some of the same discomforts you had in your second trimester will continue during your third trimester. You may have difficulty taking big breaths, and you may need to go to the bathroom more often. This happens as the baby gets bigger. The increase in your baby's size puts more pressure on your organs. These problems often will go away once you give birth. Some new body changes you might notice in the third trimester include shortness of breath, heartburn, swelling of the ankles, fingers, and face, hemorrhoids, tender breasts which may leak watery pre-milk called colostrum. Your belly button may stick out. Trouble sleeping. During the third trimester, you may also feel the baby dropping or moving lower in your abdomen. This is called lightening. You may also experience contractions, which can be a sign of real or false labor.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Third trimester. Your emotions. As your delivery date nears, some fears about childbirth might be stronger than before. Common concerns include the pain and duration of labor and how to cope with being a new mom. Classes on childbirth can help you learn what to expect and provide a way to connect with other women who are going through the same things. Ask your healthcare provider about your options for pain relief during delivery. Often during the third trimester, the idea of becoming a parent is more real than at any other time during your pregnancy. You might feel scared and stressed out. This may be especially true if this is your first baby. To stay calm during the third trimester, make time to relax. Read a book, practice yoga, meditate, get a massage, or take a bath. Take time to think about the joy that will come from bringing a new member into your family. You may also consider keeping a journal of your thoughts during the pregnancy, talking to your unborn baby, taking photos of yourself during pregnancy to share with your child one day. Planning ahead can help put your mind at ease. Consider whether you'll be breastfeeding. Gather supplies to prepare for delivery, like a special pillow to use while breastfeeding and a breast pump. Consider whether to circumcise your child if you have a boy. Another way to prepare for motherhood is to consider who will be your baby's healthcare provider. This type of doctor is known as a pediatrician. You should also begin planning the first few weeks that you'll spend with the newborn. Visits to your healthcare provider. You may have checkups more often during the third trimester. You may come in every 2 weeks, starting at week 32, and every week starting at week 36. During these visits, your healthcare provider will check your weight and blood pressure. You will be asked about any symptoms you are having. During the third trimester, your healthcare provider may ask to screen for various conditions. These include gestational diabetes, anemia, Group B strep. Gestational diabetes is diabetes that starts during pregnancy. Your healthcare provider can recommend treatments and lifestyle choices to help you manage it. Anemia is an unusually low level of red blood cells or hemoglobin. Hemoglobin is a protein in red blood cells that contains iron. Anemia can slow your baby's growth or trigger preterm labor. Iron supplements are often used to treat anemia. Group B strep is bacteria that doesn't harm you, but it can give your baby an infection after birth. It may be treated with antibiotics. The heart rate and size of the baby will be monitored during the third trimester. As the end of your pregnancy gets closer, vaginal exams are done. Vaginal exams can help the healthcare provider determine your baby's position inside your uterus. Your healthcare provider might also check your cervix to see whether it has begun to soften or dilate. This happens in preparation for birth, but cervical exams are not a reliable way to predict when labor will begin. Talk to your healthcare provider about your wishes for labor and birth during this time. As your delivery date draws closer, be sure to review the plan with your healthcare provider. You may consider water birth, a natural birthing option that takes place in a tub or pool of warm water. This can reduce labor pain and give your baby a gentle entry into the world. Giving birth at home, a birthing center, or a healthcare facility. Giving birth without using pain medication. It is your right to ask questions about your pregnancy and delivery. By understanding what is happening, you can help yourself have a positive birth experience. Some questions you may want to ask your healthcare provider include, how can I tell the difference between false labor and the real thing? When do I need to go to the hospital? Could I arrive too late to have an epidural? Living healthy. Being pregnant may also require some lifestyle changes. The following includes some tips on what to do and what not to do while pregnant. Important tips for a healthy lifestyle while pregnant include: don't smoke, drink alcohol, or use illicit drugs. Avoid secondhand smoke, which can be harmful to you and your baby. Don't take very hot baths or use hot tubs or saunas. Get plenty of sleep. Find ways to control stress. Women should gain a healthy amount of weight while pregnant. Talk to your healthcare provider to learn what a healthy amount is for you. You can nourish yourself and your baby by eating healthy. Smart choices about pregnancy nutrition can help you promote your baby's growth and development. Eat a diet that includes grains, fruits, vegetables, protein, dairy, and water. Even if you eat healthy, you may not be able to get all the nutrients you need from your diet. Many doctors recommend starting to take a prenatal vitamin at least 3 months before becoming pregnant. You may need special supplements if you have dietary restrictions or certain health problems. Tell your healthcare provider before you take any new supplements or medications during pregnancy. Unless your healthcare provider tells you not to, try to get at least 2 hours and 30 minutes of aerobic activity each week. Aim for a moderate level of intensity. Try to spread your workouts throughout the week. It is important to get informed during your pregnancy. Read books, watch videos, and talk with moms you know. You can also ask your healthcare provider about childbirth education classes. These can help you prepare for the birth of your baby. While pregnant, you should stay away from chemicals. These include insecticides, solvents like some cleaners or paint thinners, lead, mercury, paint, including paint fumes. Not all products have pregnancy warnings. If you're unsure about the safety of a product, ask your healthcare provider before using it. Toxoplasmosis is an infection caused by a parasite sometimes found in cat feces. If not treated, toxoplasmosis can cause birth defects. You can lower your risk by avoiding cat litter and wearing gloves while gardening. You should also avoid contact with rodents while pregnant. This includes pet rodents and their urine, droppings, or nesting material. Rodents can carry a virus that can be harmful or even deadly to your baby. Take steps to avoid illness while you are pregnant. One way to do this is by washing your hands frequently. When to call a healthcare provider. You should contact your healthcare provider at any point during your pregnancy if you are concerned about your health or the health of your baby. Although your body will go through a lot of changes, many of them are normal. But some changes should be reported to your healthcare provider. They may be signs of a problem. Call your healthcare provider if you have nausea, loss of appetite, vomiting, jaundice, fatigue combined with itching. These symptoms may be signs of a serious liver problem. If you notice any sudden or extreme swelling, or if you gain a lot of weight really quickly, call your healthcare provider right away. This could be a sign of preeclampsia. Preeclampsia used to be called toxemia. It is a condition in which pregnant women experience high blood pressure and a high level of protein in the urine. Swelling often happens in the feet, legs, and hands. It usually happens during the later part of the second trimester or during the third trimester. You can call your healthcare provider at any time to discuss concerns about your pregnancy. Getting answers to your questions can reduce stress, which is better for you and your baby.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The third trimester of pregnancy refers to weeks 29 through 40. Pregnancy lasts about 40 weeks, counting from the first day of your last normal period. During this time, your baby is getting bigger and has less space to move around. As your delivery date nears, some fears about childbirth might be stronger than before. Common concerns include the pain and duration of labor and how to cope with being a new mom. Classes on childbirth can help you learn what to expect and provide a way to connect with other women who are going through the same things. Important tips for a healthy lifestyle while pregnant include: don't smoke, drink alcohol, or use illicit drugs. Avoid secondhand smoke, which can be harmful to you and your baby. Don't take very hot baths or use hot tubs or saunas. Get plenty of sleep. Find ways to control stress. Call your healthcare provider if you have nausea, loss of appetite, vomiting, jaundice, fatigue combined with itching. These symptoms may be signs of a serious liver problem.
Thank you for using Explain.